Good afternoon and welcome to today's webinar, From Promise to Proof, Operationalizing Innovation with Accountability. Hello, I'm Deborah Hoyt, Axxess's Senior Vice President of Public Policy, and I'm delighted to serve as your moderator for today's discussion. Today's event is part of the Axxess AI Innovation Series, where we explore how artificial intelligence is transforming home health, hospice, personal care, and palliative care delivery. Today, our panelists will explore coding accuracy validation, intake exception management, scheduling optimization, and predictive patient engagement while addressing the ethical, compliance, and workforce implications of automation. You will take away practical adoption lessons from a national home health operator, a disciplined framework to evaluate AI vendors, and a leadership checklist to ensure that automation never outpaces governance. Please note that the webinar questions feature box is open. The panelists will answer relevant questions during today's conversation. We will also follow up with an email to all registrants with answers and links to the webinar recording. Now it's my pleasure to introduce our panelists. First is Jay Banks. Jay is Head of Sales at Olli Health. Shraddha Ayer, Senior Vice President of Solution Delivery for Axxess, and Preston Lucas, Chief Financial Officer, Interim Healthcare, Great Lakes Health Partners. Hello, Jay. Let's get started with you. So, Jay, tell us a little bit about Olli Health and how you work with home-based care providers to automate their operations, drive care delivery efficiencies, and achieve cost savings.
Absolutely, Devin. First off, I really appreciate the opportunity to be here alongside Axxess and Interim Healthcare of the Great Lakes and to be with all the folks on the webinar today. At Olli Health, our focus is truly very simple. It's to help home-based care agencies improve their documentation accuracy and also at the same time accelerate their turnaround times and reduce their operational cost burden associated with coding, with Oasis QA, and with Plan of Care through a managed service model that combines AI with certified human clinical reviewers on every chart. What makes our approach a little bit different than most traditional outsourced vendors is that the accuracy and the speed is the product that we actually deliver. So we're not providing a software, and what we are delivering is production-ready coding and Oasis QA results that agencies can trust immediately inside of their workflow. And so practically speaking, we work with agencies like Preston's by reviewing their coding, their Oasis assessments, and increasingly their plans of care as audits start ramping up. And we return those charts very quickly. So typically we return them about 4 times faster than traditional outsourcing models while maintaining a greater than human accuracy, which is about 98% accuracy on production charts today. And what that does is it does 3 things operationally. First, it reduces the documentation friction for clinicians. So instead of second guessing coding decisions or waiting days for QA feedback, clinicians are getting clear, consistent guidance that actually helps them learn what compliant documentation looks like over time. Secondly, it improves DSO or throughput for the agency. So when charts move faster through the coding and QA process, agencies can accelerate their cash and their final claims readiness and their overall revenue cycle velocity. And so that's especially important today when the margins are and the staffing remains a challenge across the industry. And third, and this is a part of the leadership teams really appreciate, it not only reduces the total cost per chart, but it also provides them relevant feedback on each of their clinicians to let them know which clinicians are doing really, really well as it relates to documentation of coding, Oasis, and Plan of Care. But it also gives them suggestions on how to make real-time changes to that. So traditionally, agencies have had to choose between speed, cost, and accuracy. The old saying is you could pick 2 of those 3. What we're seeing now with Olli is that agencies are able to achieve all 3 simultaneously because our model combines automation with clinical oversight rather than replacing one from the other. And from a workflow flow perspective, we are working with Access more tightly than ever. We know that integration matters a lot. We're designed to truly fit the way agencies already operate, particularly inside of Access environments. So the clinicians and their QA leaders don't have to change how they work. They're just going to receive faster, more consistent support behind the scenes. And what's been really exciting is working with organizations like Preston's and seeing how the combination of speed and accuracy and workflow alignment allows his agency to scale documentation operations without needing to scale their internal staffing at the same time. So ultimately, our goal is to help agencies protect revenue, improve their compliance, confidence, and give clinicians more time to focus on patient care rather than documentation rework. And that's where we've seen the biggest impact across the organizations that we support.
Thanks, Jay. That was really important and really critical. And I think this is revolutionizing the way we've been delivering home-based care. This is a huge step up. I wanted to ask a follow-up because in some of our previous webinars, our previous AI webinars, each month we've been holding different ones. We've been talking about providers' eagerness to adopt AI or to embrace it or even to get started, right? So they get started in some kind of a pilot mode. Some are fully in and succeeding in AI deployment. Can you talk a little bit about what distinguishes home-based care organizations that succeed with AI deployment from those that kind of either can't get started or stall in a pilot mode?
Sure. One of the things that we see with organizations like Preston's is they have great communication at the leadership level all the way out throughout the organization. So not just at the C level, which Preston is at, but also through the clinical team managers all the way down the organization of how the AI is going to impact their daily workflow and what's in it for them, quite frankly. And one of the big things that we also see is that they have a change management process that they thought about and they put in place. And so they're able to make sure that all the areas that are being touched by the technology or the service that's being employed, that everyone is on board. They're providing their feedback in real time and getting that feedback back to their partner, being us and Access, but also to downstream to their clinicians. So it's really been great, not only working with Preston, but so many agencies across the country. Many of them are using Access today.
Thank you, Jay. Very interesting. We really appreciate that. And we're so glad that you were here with us today. So let's move on to Preston. Preston, welcome. Thanks for joining us as well. Um, why don't you share with us a little bit of background about Interim Healthcare and why the company chose to be an early adopter of artificial intelligence in the home-based care space?
Yeah, absolutely. So, for a little background, our Interim Healthcare franchise operates as a multi state home health and hospice provider. And like most organizations in this space, we're constantly balancing clinical quality, regulatory requirements, and operational efficiency, of course. But where AI became really interesting for us wasn't really from a technology standpoint. It was truly from the operational standpoint, and that's where we started looking at where our teams were spending a lot of time on administrative work that didn't really require clinical judgment. That ultimately led us into areas like AI assisted coding and Oasis QA with Olli, and also tools for referral summarization to support our intake teams. And I think one tangible example of this is with some of those intake tools, we've been able to centralize our intake functions and streamline the admission process, which has allowed us to ultimately increase capacity in a number of our markets without having to scale staffing at the same rate. And I think that's really the lens we use and kind of important for everyone to hear is AI should reduce friction and create capacity, not just add another layer of technology. So from our perspective, AI isn't successful because it's technically impressive. It's truly successful when it fits naturally into workflows and helps teams operate, more efficiently without disrupting how they deliver care.
Thank you, Preston. Very, very impressive that you've moved this quickly. So how long did it take for Interim to move from kind of an AI pilot mode to fully operational? And what had to be achieved internally before you were confident enough to scale AI agency-wide?
Yeah, honestly, I'd say there wasn't really a single moment where we said, okay, now we're operational. It was truthfully more of a progression. And, we started in a very controlled pilot environment, with limited teams, very specific workflows that allowed us to focus on how the tools performed in our actual day to day operations. The shift towards scaling really happened when a few things started to consistently show up. So first we saw clear operational value, whether that was helping intake move faster or allowing our QA and coding teams to keep pace as volume increased. It was truly showing up in their daily work. I think secondly, and probably most important, our team started to really trust it. And that's a huge one when you're talking about AI. Early on, there's always some hesitation, especially from clinicians. But over time, as they saw the tools were really helping them and not replacing their judgment, that trust started to build. And I think that's the key. Adoption really doesn't happen because leadership says so. It happens when the people using it believe in it and start to embrace it in their day-to-day workflows. The third piece was really clarity around where AI fits and where human accountability remains. So for us, that meant being very clear. AI can support and recommend, but for the final decisions, they stay with our team. And so once those three things were really in place, the proven value, the team trust, and the clear guardrails, scaling became a much easier decision within our organization. And even then, we expanded very intentionally. We didn't scale just because the technology was ready. We scaled because the organization was ready. And I think that's really, really important for everyone to consider.
Excellent guidance. Thank you so much for sharing that, Preston. We'll explore a little bit more later. Let's move on to Shraddha. Hi, Shraddha. Can you help us understand how Access engages with interoperability partners like Olli Health and how that relationship benefits home health and hospice providers like Interim?
Absolutely. No, thank you so much for that question, Deb. And I see some questions in the chat that I'm going to try to address or weave into as well, just from compliance and data storage perspective. And I welcome Jason to add context as well. But one of the opportunities that we've seen in care at home, it's beyond AI, is just true alignment between clinical teams, operational teams, financial teams. It's something that is always a struggle. Leveraging technology, like Preston said, is one part of it, but it's really operationalizing technology that is meaningful. And at Access, we have taken a platform first approach. And what I mean by that is we want to be a completely connected ecosystem for our interoperability partners so that our clinicians, our operators, our RCM teams, they are in the solution day to day. That's where they sit. And integrations just work seamlessly through data exchanges. Now we're extremely intentional and selective when it comes to our partnerships, and we conduct rigorous due diligence across clinical accuracy, compliance, alignment. In fact, we follow AI governance process that we have put our partners like Ollie through. And because of really this rigorous process that we do internally, providers like Interim can really trust on the quality and the foundation of AI. Every partner that is part of our ecosystem needs to meet a high standard of reliability, accountability when it comes to what the AI is projecting, and then ultimately ensuring that there is human oversight to the AI assisted documentation. And I think Ollie is a great example of this partnership. They've delivered AI powered coding, quality review capabilities that really do influence compliance while ensuring that the human element of reviews are completely central to the process. Through our partnership with Ollie, documentation is going to flow directly so that coding workflows can happen very quickly, leveraging the AI assisted workflow. the structured data that can come back into Access so that the documentation can be closed and ultimately billing can happen very seamlessly. And what this means is, truly a trusted ecosystem of integration while leaving the individuals to help make the decisions still completely empowered to do so. Because when you introduce technology and you especially introduce AI, um, ensuring that that content is very open and very honest with respect to um, verification and validation with humans has been a great example of our partnership so far.
Thank you, Shrana. That's a really nice opportunity to be able to, talk about relationships and interoperability, which I know is so important to Access and to all of these technology partners at this time as we're kind of paving this new future together. So thank you. So that's a good segue to talk to Jay a little bit more about how Olli is um, rolling out its services and working directly with providers. So Jay, when you report coding or OASIS QA accuracy, how are you validating it? Do you measure precision and recall separately? And what is your accuracy on live production charts?
So it's a great question. It's honestly one of the most important questions agencies should be asking any coding or OASIS QA partner today. When we talk about accuracy, we're talking specifically about performance on live production charts. So not testing environments, not pilot-only databases, not isolated benchmark scenarios. Every chart that goes through our workflow is reviewed using a combination model that includes our AI automation supported by certified coders and clinical reviewers. So I saw some questions in the chat about how does AI take the place of human coders or does it take the place of the reviewers? The answer is no. We actually still have clinically certified coders and QA specialists that review every chart. So where does the AI come into place? Well, it comes into place in aggregating the data, summarizing the data, and we constantly measure the performance continuously through our own internal QA audits as well as client side validation. And we are even looking into third party accreditation organizations, and we can get more into which organizations those are. They're also partnered with Access, so highly trusted and respected, to do a third party validation on the accuracy. So when we report greater than 98% accuracy, that number reflects real world production across thousands of charts, across active customer environments, across different comorbidities and different teams down to the individual clinician level. Now, your question about precision and recall, we do track both of those metrics because they tell very different stories. Obviously, precision is helping us understand whether the codes that we assigned were correct, and recall helps us understand whether we're capturing everything that should be coded. And in home health documentation, recall is actually just as important as precision because missing diagnoses can directly impact the reimbursement accuracy, risk adjustment alignment, and the care planning quality. And so many vendors that talk about accuracy in a single number format, internally, we're evaluating whether we're both assigning the right codes and capturing the complete clinical picture as it's represented in the chart. In addition to that, we're maintaining an ongoing calibration process between our automation layer and our clinical reviewers so that the performance remains consistent as the regulatory guidance evolves, or OASIS guidance changes or documentation patterns shift across the agency. Another important point here as we talk about this particular topic is about transparency. So we encourage our customers to validate our performance directly through side-by-side comparisons. One of the great ways to do that is that we do offer a pilot at the beginning of our customer engagement. So during pilots or early production phases, because accuracy, obviously shouldn't be something that you have to take faith on. It's something that the agency can observe inside of their own charts. And what we typically see is during those validation periods, it's not just a strong alignment rate with the internal QA teams, but it's also a meaningful reduction in their downstream documentation corrections and rework from clinicians. And so ultimately, that's the outcome that matters most, not just the percentage itself, but the confidence that the agency knows that the charts are complete, that they're compliant, and that they're ready for submission the first time that they move through the workflow. And that's really how we define accuracy at Olli Health, is that performance that holds up in a live production environment and supports both compliance confidence and operational efficiency at scale.
Thank you, Jay, for that explanation. That was very helpful for me to even understand that. I appreciate that, and I think our viewers do too. Let's move on to Shraddha. Shraddha, how does Axxess ensure that AI-driven documentation or decision support doesn't introduce compliance or clinical risk inside the workflow?
Thanks for that question. And I think it really builds on top of what Jay has outlined. So for us, this is a very critical question. It is one that we approach with a really, really high level of rigor. So at Axxess, we ensure all the AI that we've built or partner with has a true workflow of not introducing any risk. We lead with clinical integrity, governance, and security. And I'm going to explain a few of those things in the next couple of points. So firstly, we have a very high selective focus group, which really drives our AI capabilities and partnerships that we bring into our platform. We evaluate every feature that either we're building or partnering with our partners on from an interoperability perspective are evaluated on clinical accuracy, regulatory alignment. So is this something that AI should touch? That's a question that we ask ourselves consistently. And then how far should it touch? And at what point does the human need to come back? And what are the audit trails that we need to put in place to ensure that a human, whether that's a clinician or someone in the back office, has audited, verified, and signed off on what AI has generated. Secondly, we truly, of course, also ensure security. Everything that we built is deeply integrated into Axxess's private cloud. So it's all secure, it's all behind our servers. There's no external, third-party performances that we're embedding. Of course, when we do lean into partners like Olli, we go through the process of verifying the same security assessment as well. Secondly, speaking about Axxess Intelligence, just really Axxess overall, we leveraging our private cloud, our servers, our entire ecosystem gives us the ability to truly bring in models, safeguards, HIPAA compliance, and really HIPAA compliant grade security to meet compliance expectations. And beyond just HIPAA compliant expectations, we have aligned all of our AI integrations or AI that is natively developed by Axxess to the NIST AI framework, which is really the National Institute of Standards of Technology. This is a national framework body, and they have created an AI risk management framework that Axxess is very deeply aligned to. The focus of this framework is really threefold. It is risk mitigation, so really making sure that the AI does not go too far for making decisions, bringing in transparency. So how does the AI make decisions? Where does the AI pull the data from? How accurate is it? We report on all of these pieces. And then lastly, of course, accountability. So how do you have accountability? And then from an operational standpoint, we ensure that we embed AI with clear guardrails. In Ollie's case, they have a full auditable report that they can provide with respect to everything that has been done because of the human coding experts that are part of their ecosystem and their technology. And then on our end, we have every action that is generated or pulled in is completely traceable. There are audit reports to support compliance and quality assurance, and then of course regulatory review. And ultimately, we maintain, the human having oversight model where clinicians and operators remain in control. AI is supposed to support the decision making, not replace clinical judgment. And then lastly, I'll say we continuously monitor the performance of all AI systems, whether that's in partnership with quality checks or just truly through reporting when we have access to it, to ensure that we have the highest standard possible with respect to compliance, and ensure that we can publish any changes that we're making to these compliance frameworks as well. So all of this is just really part of our NIST AI risk management framework that we have implemented, which we also lead it to and leverage for our partners.
Thank you, Shraddha. Preston, we're going to move on to you. Shraddha was talking about humans. We are in an AI webinar, but we haven't talked much about humans and really how that plays into care at home. I mean, we know that that's always been kind of a high touch, very intimate relationship between the clinician in the home and the patient and the family. So, Preston, from a home-based care provider perspective, where do you choose to keep humans in the loop, and where have you intentionally decided not to automate?
Yeah, Deb, this is something we've been very intentional about. Just as Shraddha mentioned in her response, the principle for us is pretty simple. AI can recommend, but it truthfully does not make those clinical decisions for our team. And so we truly use AI to support things like coding review, summarization, identifying potential issues. But the clinician is always that final decision maker on the clinical side of things. And that's been really important too from an adoption standpoint. Early on, there's always some level of skepticism when you're talking AI and talking new solutions with your team. And honestly, there should be, people don't necessarily know exactly what's coming, but these are clinicians that are responsible for patient outcomes. And so what we've found is that adoption improves when clinicians are involved in that process and can see over time that the tools are there to support them and not replace them. So where we're comfortable leaning into automation is more on the administrative side, things that create that friction in day-to-day workflows and don't really require significant clinical reasoning. But anything tied to direct patient care or compliance, that stays firmly with the clinician. And I think when you get that balance right, you see that conversation shift from, is this replacing me, to this is actually helping me do my job better. And that's what's been helpful for us as we've looked at AI and begin to roll it out across our organization.
Thank you, Preston. Shraddha, let's go back to you and stay on with that balance between AI and human judgment. Why don't you share with us how you at Axxess are looking at that balance between AI and human judgment as you are embedding and building AI across the Axxess platform?
Oh, thanks, Deb. And I see a few of those questions in the thread as well. So I'll try to make sure I address some of those comments, but um, we'll preface as much as we can. What we're really trying to do is foundationally starting with data, right? We're a platform. Like I said, we're a connected ecosystem. So what we have done as we have embedded AI is really work to identify real operational frictional problems. Of course, the few that we've identified is clinical documentation, intake, scheduling, revenue cycle management. Those are friction points. That's what we internally at Axxess, being the EMR, can really help reduce the burden of without being an expert, like a coding solution, as an example. There's a very expert level of solutions there. We can remove the burden and create a lot of impact at friction points. So our philosophy has really been simple. We have built AI to augment human judgment, not replace it. So we've created the guardrails to ensure compliant execution, more accuracy, ensuring consistency in how our clinicians operate day to day, how our schedulers operate day to day. That's really the goal of AI, is if you can create consistency in all your roles performing to the same level and the same measure, that's success. We've also recognized that ultimately AI needs to meet the users where they are. Preston alluded to this when he talked about his clinicians um, needing to adopt it, needing to see the proof in AI, and needing to understand that it is going to make their lives easier. And that's why we believe in deep embedding of these solutions. Our goal is for AI to become a force multiplier across every role, whether that's for clinicians, our intake team, scheduling, billing, RCM, coding services. And what we're doing at Access is really focusing on the agentic capabilities. I see some questions about, is Access going to solve X, Y, and Z? So I'll try to capture as much of that as I can. But that's really what we're focusing on, is agentic capabilities, so that those AI agents can do a lot more of the repetitive tasks, and our clinicians, as an example, can focus on patient care, not documentation. So we've introduced ambient listening capabilities that reduce the burden of documentation to a small subset of our clients, and we're working to introduce it to everyone here shortly, where our ambient listing agent is already built into the mobile solution. It's capturing information in the background in a structured way. It is, completely offline available. It's in the secure access ecosystem because it's in our secure app already. It does what it needs to do. At the same time, it helps benefit partners like Olli Health because that information is captured early, so that it can drive, better compliance, better quality measures quickly, especially if you're capturing documentation at point of care. In addition to that, now we've also realized billing is such an area of opportunity. So we've introduced a billing agent that really just does one thing, and does one thing well. It gets claims out the door quickly. It ensures that claims can be processed faster, and our billing team is working on managing billing by exception. So instead of our billing teams in our businesses trying to just get the claims out, the agent will get your claims out for you as long as all the billing adjacent operations are ready. And it'll help you identify, hey, you need to go talk to, these clinicians, because typically they're the ones that don't submit information well. So it's helping bridge the gap between our billing team and our clinical team to ensure that that ultimate billing happens out the door uh, very quickly. And of course, individuals have the ability to, lots of control flexibility. That's what we call it internally at Access, to ensure that claims do get out the door faster, but you have ultimate oversight on them. And then finally, what we realized, and I'll just touch on this for a second, is we're seeing AI shifting how users interact with technology, right? That's what generative AI is. That's what GPT is. You don't go into Google now and type a bunch of words. You go to ChatGPT, or if you go to Gemini, you just ask questions, and the AI helps you get the answer that you need very quickly, instead of you all clicking through multiple links. So it's shifted how we as humans will interact with technology and how we consume information. And that's what's led us to add Ask Access, or build Ask Access into our solutions. And Ask Access is our enterprise assistant that's completely embedded in the platform. It allows users to interact with the system, whether that's navigating from one place to the other, whether that's getting information, insights in real time. You don't have to go pull reports anymore. You can access a question to tell you, patients with a certain medication, patients with a certain level of care, caregivers that haven't had a visit assigned to them in a couple of days, to measure utilization. It's really just giving you insights so that you do not have to go click, click, click. And that's really how we're trying to help our users get more productive leveraging AI, right? Ask Access isn't going to replace the human judgment, but it's going to give you better data, better insights, uh, from the entire Access ecosystem so that you can make better decisions or get to decisions faster through the workflow. So a lot more to talk about, but I want to just touch on a few things while also keeping our partnerships front and center. Thank you, Deb.
Thank you, Shravana. Let's move on to Preston. Preston, you've been talking about Interim Healthcare as an early adopter of AI and what your philosophy has been and how you've been thinking about it. But let's move on to results. So, has Interim achieved quantifiable gains in areas like time to admit or billing accuracy that correlate with Interim's AI adoption? And if so, how can you validate that these improvements were linked to your organization's AI adoption?
Yeah, absolutely. And honestly, I want to pause for a second and just kind of expand a little bit on Shraddha's here is that many of us truthfully have been using a level of AI in our daily workflows for quite some time, but haven't really, necessarily realized it until more recently as it's become that larger talking point when discussing technology. And so for those, home care providers on the call, I think a few of those examples are very clearly, most of our solutions are running automatic eligibility checks. We have revenue cycle management, claim scrubbing to make sure all elements are present before sending that claim out the door. And so, there's many different areas that you could look to in your current workflows that are already AI driven, but you just may not necessarily realize that. But with the recent surge in AI, we're now seeing that, come front and center for everyone to talk about, and what does that look like in the various solutions, and how can things become even better and faster and more efficient for all of us. So I just kind of wanted to add that on for the providers on the call to call that out. But Deb, kind of back to your question, I'd say we're really seeing meaningful operational improvements even as we continue to refine how we measure them. A few of the biggest impacts that we've seen more recently have been on the intake side and the QA and coding side, with tools that have helped us summarize and structure referral information. We've been able to centralize our entire intake team and streamline that admission process across all of our locations. That ultimately has increased our capacity in several markets, allowing us to provide more start of care slots in various markets, given that faster intake and time to admission. I think when we're looking on the coding and QA side, with Ollie and Jay's team, as that intake volume has grown, our teams have been able to keep pace without scaling at the same rate. And that's something Jay alluded to early on. And I think one of his or second question or first question, but that's a really strong signal for us that the tools are actually working operationally, because if they weren't, we'd have to be adding additional staff as we continue to grow to augment that workload. And so it's really important that you're seeing that correlation between, the volume growing, but the staffing has not necessarily had to grow at the same rate. And I want to really be clear that we haven't gotten here by just jumping into any particular solution on the market. We've been very selective early on in evaluating partners like Ollie and others in the space. It truthfully wasn't about choosing the newest or most advanced tool out there. It's been more about deliberate pilots and consistent monitoring, and ultimately selecting the solution that has delivered the most value in our environment for our organization. So while we're still refining the exact metrics directionally, where we're really seeing improved efficiency, increased capacity, and a better ability to manage growth, which is really what we're aiming for.
Excellent. Thank you, Preston. So we have about 2 minutes left in our conversation. This has been very interesting. So to wrap up, let's do a 30-second round robin closing question for each of you. Jay, let's begin with you, and then we'll move on to Shraddha, and then finally back to Preston. So the question is, what's one mistake organizations commonly make when implementing AI in care at home? And what advice would you give those leaders who are trying to avoid mistakes?
Sure. So one of the most common mistakes, I think Shraddha and Preston actually put their finger on it, is making the assumption that partnering with an AI-based solution is a replacement for clinical expertise instead of a tool that should extend it. In documentation especially, we see some AI-only approaches that often look efficient at first, but they create downstream rework or compliance uncertainty, extra burden for clinicians if the accuracy isn't built into the workflow from the start. I saw a question about prompt tune based models, and those can be very helpful for summarization, for drafting, even identifying documentation patterns. But there's a difference between that and production grade coding and Oasis QA in the home that requires more than just large language models. It requires clinical judgment. It requires regulatory interpretation. It requires accountability at the chart level. So in real world environments, agencies, they don't just need suggestions, they need real results they can trust on. And so the advice that I give leaders is this: focus less on whether something is AI powered and more on whether it produces production ready results that your team can trust, and does it quickly and at a cost that is decompressing the margin crunch that you're under today. So that would be my advice.
Thank you, Jay. On to you, Shraddha.
Thanks, Deb. And I'll add to one thing Jay said. So I think something you all have to remember is that all of these LLMs that we use externally. So if you guys use, ChatGPT, Claude, Gemini, whatever you want to use out there, they've been trained on Reddit. There's a lot of things they can do well. There's a lot of things they can't do well. And I think that's really the difference between an LLM being leveraged to do things like summarize this document for me, or hey, help me identify something out of a table, as compared to truly being able to deepen clinical expertise and then not really replicate, but be able to refine clinical expertise in care at home. And I think that's really what our organizations are doing. Is we've taken the concept and the technology, but ultimately we're creating refinement for care at home. So my final thoughts are really just that: is that ask yourself, where do you want to have the greatest impact? Look at your friction points across the board. Is it, are you having struggle with intake decision support? Is it, your clinical team maybe not being able to operate consistently at the same level? You have some great clinicians, some clinicians that need some additional support. Is it billing? Like, really look at where your truly, operational opportunities are, and start there from an AI perspective, because it's really, really important, for AI to be done well and implemented well and adopted well. And then the last thing is just really remember that you want your data to stay within your organization, within your ecosystem. It's very easy for data leakage or data hallucinations to happen. So truly, truly, lean into AI being a force multiplier, but leverage clinical guardrails deeply, as well as leverage operational guardrails to really augment your team's expertise instead of replacing them. Thanks, Deb.
Thank you, Shraddha. Preston, you have the final word. On to you.
Oh boy. I'd say truthfully, the biggest mistake is moving too quickly without validating the value. AI is evolving really fast and it's easy to get caught up in those new capabilities. But the organizations that are most successful are the ones that stay disciplined behind it. And so pilot that solution, involve your teams early, and make sure it actually improves how your organization operates before scaling it out further. And truthfully, just as important, keep your clinicians at the center of that process. If they trust that the tools and can see the value themselves, the adoption will follow. But if they don't, it won't matter how good the technology is. It will fail for you across the organization.
Very good. Thank you. So in closing, I'd like to thank all of you, our panelists, Jay Banks, Olli Health, Shraddha Air, Axxess, and Preston Lucas, Interim Healthcare, Great Lakes Health Partners. And obviously to all of you, our audience, thank you for joining us for this webinar. To learn more about how Axxess Intelligence can help your organization become an AI-first provider, visit axxess.com. And join us in Dallas, May 4th through 6th for Agile 2026, the Axxess Growth, Innovation, and Leadership Experience. A link to the registration page is right there at the top of your screen and has been during this webinar. I hope you've taken advantage of that. And there's also a QR code here for you as well. Lastly, look for an email from Axxess in the next few days. It'll have a link to this webinar recording and any previous webinars that have been in this Axxess AI series. You can also tap into those recordings as well. We'll try to also answer questions that we didn't have enough time to answer in the chat and get those to you in writing. So we look forward to joining you again, hopefully in April, when you come back to hear a little bit more about Axxess AI in our innovation webinar series for that month. And we wish you all a wonderful day. Thanks for joining. Thanks again to our panelists.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.